scoot a little bit to the edge. Thank you. So now I just want you to get like the worst posture, terrible, just slump those shoulders. Good. You go ahead and bend there, sit next to you, and just relax. I'm gonna extend that leg out, okay? You tell me if you have any pain at any moment, all right? So I'm gonna just passively extend that leg.
My hamstring's a little tight.
I can feel it. So she was able to identify the pain right there, and I was actually able to feel it as well. If she had pain at any moment, I might drop the leg below if we couldn't identify if it was hamstring, and I could go ahead and dorsiflex the foot as well to identify that it's sciatic pain. What? So I would ask her pain descriptor questions. She already told me my hamstring was tight. If she just said pain, I might ask, does it shoot down the foot? Is it really sharp? Is it a tightness? Things like that. So I could also do the Kemp's or lumbar quadrant test in this position. So I'm going to go ahead and do that. So Olivia, what I want you to do is just go ahead and extend that back. Then I'm going to have you bend this way and then rotate away. And I'm just going to put pressure. Let me know if you have any pain, okay? So you're push down. Any pain?
No.
Okay. So I would do that for both sides. If she had pain on this right side for that test, then I would suspect maybe facet pain. And if she had pain on the left side with that, then I'm looking probably muscular. So while on this test, I can go ahead and do some PIVMs. So Olivia, I'm gonna kneel down right here. We're gonna do the best we can. You scoot towards me. Okay. So what I want you to do is just relax your head on my shoulder. Good. I'm gonna lift that shirt up. Okay, so I'm gonna support her and go ahead and relax into that low back. Relax. She doesn't want to relax, she never does. So I like to go ahead and find that PSIS and scoot over, and I'm gonna know that I'm at L5. And I'm gonna put my fingers on L5 and L4. I would also test S1 of course too, and I can go ahead and do flexion, relax, good. I can do extension, I could do rotation, I could do side bending, good. All right, relax. So if I was doing that for real, I would go ahead and start like S1, L5, and I would do each position like flexion. I'd move up the whole spine before moving on to the next. I'm looking for gapping, I'm looking for even spaces within the spine. I'm wanting them to move equally and together. So that's just about most of what I'll look at in sitting. So after that, I'll go ahead and have you stand, Olivia. And can you go ahead and face away from me? Okay, so is it okay if I palpate back here in your low back? Yep. Okay, so I'm going to find her PSIS. There it is. Okay, so what I want you to do in a second is I want you to bend all the way down and try to touch your fingers to the floor, okay? Okay, and I can also look, so I kind of did 2 tests at one, so you can go ahead and stand back up. So by feeling your PSIS, I'm doing the standing flexion test. So I want this PSIS to rotate forward as she bends down equally. And I also looked at how far away her hands went when she went down to the floor. That's sort of a range of motion test for flexion, but also if she has more than 10 inches, which she probably honestly does, I'm just not going to pull anything out right now to measure, then I know that she's got some lumbar hypomobility going on. So that was the standing flexion test. That was the finger to floor test. I also could go ahead and do like the march test. So Olivia, I'm gonna palpate on your booty, okay? Okay. All right. So I'm gonna find the ischial tuberosity right there. And I just want you to bring that right leg up to your chest and back down. Good. So I'll do both sides, and I'm just looking for the. Okay, so the video cut off right as I was explaining that because I had too many pictures. So anyways, the explanation for that march test was I want the ischial tube to move forward and out equally on both sides. So now we'll go ahead and move to supine. So Olivia, if you could just lay on your back. Okay, good. So I'm also looking, I would have checked lumbar range of motion. We're both forgetting that today apparently. So while I was in that position, I would just have her bend all the way forward like I already did. I'd have her go ahead and do extension. She would put her hands on her side and side bend both ways. I'm looking for the fingers to be equal, and we would also look at rotation. I could just do a gross, like a percentage, or I could do I could use a goney or I could use an inclinometer. So if I use an inclinometer, I could bracket the spine. I could just do one. There's several ways to do it. None of them are particularly reliable. So now that she's in this position, Olivia, I just want you to go ahead and relax. I'm going to lift this leg up, okay? So I want you to let me know if you have any pain, and then we'll stop, and then you can describe the pain to me, okay? So if she's having pain on this right side, I'm just going to lift this leg. And actually feel some hamstring tightness right there. If she had pain between 30 and 70 degrees, that's a red flag for maybe some lumbar origination, some sciatic pain. So if she had pain and I wanted to be sure as to whether or not it was lumbar or hamstring, I could actually kind of drop the leg a little bit and then dorsiflex the foot, and I could also have her flex the neck, and if it recreates that sharp burning pain, then I know it's probably a sciatic origin because I stretched the sciatic. So also in this position, I can do the Faber test. So what I'll do is I'll flex the hip, I'll externally rotate, flex the knee. I'm going to put her in this position right here, and okay. And I want the knee to be about level, which she's a little bit tight, but not too bad. Olivia, let me know if you have any pain, okay? So I'm going to stabilize and just push down. No pain at all? Okay. So that right there, I'm looking for maybe there might be some SI or even some hip involvement. I could also do like the hip scour test if I'm trying to roll out the hip, where I would just pull her up into flexion, and I could just do a PA right there. I could also do, I could compress and gap the SI in this position as well to kind of rule that out because we're looking for a lumbar origin. Okay, so now Olivia, I just want you to roll right towards me. Good. So in this position, there's not as many special tests I could do. I could go ahead and have her do abduction of the hip because it's actually the proper manual muscle testing position for that. I can find the greater trochanter, move a little bit up, and go ahead and apply compression here. And I'm looking for provocation of pain for an SI issue. And also in this position, I'll go ahead and do a PIVM. So as hard as it is to do here, we're gonna make it work. Can you scoot towards me? I'm gonna get those shins right up next to me. This would be easier with mobilization strap. I just want you to relax, and I'm gonna palpate your spine and move you around a little bit, okay? So I'll do the same, finding the right landmarks again. So maybe I start at S1 and L5, or I can do L5, L4, whatever. I'm gonna move all the way up anyways. I'll go ahead and do flexion, side bending, rotation, etc. So if I wanted to do rotation, I'm gonna gap around, and I would just drop her like this. Then I'll actually drop her. Okay, and that would be much easier to see. Okay. Now, Olivia, I just want you to go ahead and flip over on your stomach. Okay. So once she's in this position, I could actually go ahead and do a manual muscle test for hip extension. I can do another SI test where I'm going to apply compression. So, Olivia, I'm going to press right here on your pelvis. I just want you to let me know if you have any pain. Okay. So, right in the middle of the sacrum. I'm just going to apply PA pressure. Anything? Okay, relax. I can also look to see if this relieves any symptoms, because with some patients that might be another indicator. So the other test I could do here is I could do the femoral stretch test. So Olivia, I'm going to bring this back up and see if your heel can touch your bottom. She's a little tight, so I feel a little bit of springy. You good? You feel she's got a little bit of hesitancy there. And then I can also test the quad length by fully.
It ain't long.
Not much there at all. Yep, she's pretty tight. It's popping up her whole hip. So I kind of already know right there. Where are you feeling that pain?
Front of the leg.
Front of the leg, so I know that it's the quad. And then, Olivia, okay if I lift up your shirt? Yep. Okay. So I'm going to lift up the shirt. I'm going to expose the low back. I'm going to actually look at all of the spinous processes so I can see that they're aligned, which I also would have checked probably in standing flexion. She's pretty straight. I can palpate and see that they're evenly spaced, and I can also palpate musculature. So I'm looking at muscle splay. She's a little tighter on this left side right now. And then I can use her pain to kind of indicate where I need to go.
All right.
And that would be it.
Tell me your name and your date of birth.
Yes, Alyssa Camp, 9/13/2000.
Okay. Thank you so much. So what we're going to be doing today is we're going to be doing a respiratory assessment, cardiovascular assessment, and a GI assessment. They're all going to be kind of mixed into one, but basically be just one big assessment. Okay. So I'm going to start you off, take some vitals. Okay. So if you don't mind holding that in your mouth for me. And while you're doing that, I'll work on your blood pressure. Because it'll take a minute. So. About 115 to 175. Okay. Not 175, that's done too. 115 to 75. Okay. That's important. So what was it? Yeah, your temperature was 97.8. Okay. Alright, I can put this on your finger and just rest your hand on your leg for me. That's going to take your oxygen saturation and your heart rate as well. I'm going to go ahead and get your pulse. Okay. Alright, and I'm switching to respirations. Okay. Normally you wouldn't know, but we're going to say it so that everybody knows what's going on. Okay. Alright. Everything looks great. Alright, so coming in here, I don't see any IVs, I don't see any telemetry, you're not hooked up to any monitors, no catheters, NG tubes, anything like that. Not doing an incentive spirometer. If I didn't mention it. It's not, that's the point. Have you had any coughing recently? Any chest pain, trouble breathing, anything like that? Nope. No? Any trouble breathing laying down? Any chest pain laying down? Any of that? No. Alright, go ahead and sit up for me. Okay. You put your arms on your shoulders just like this. I'm just making sure that this right here is double this. Okay. You put that down right now. I'm just going to look at your chest. I'm just checking to see that everything's symmetrical, everything looks normal, there's nothing visible that I can see. Right. Okay, and from there I'm going to go ahead and listen to you. So we're going to listen to your lungs, and then I'm also going to go ahead and listen to your heart while I'm at it. Okay. Just so you know. So what we're going to do is I'm going to move my stethoscope around, and every time I move it, I want you to take a big deep breath in, big deep breath out. Okay. And just let me know if you need to stop. Okay. And then if you'll hang your legs around this side. Okay. And listen to the back. So you can see, put your hands on your shoulders again, just like that. Deep breath. And deep breath. Alright. You can put your arms down. Oh, okay. We're going to keep going. You can go back to where you're sitting. You're gonna keep listening to your heart. Okay. switching to the bell. I'm gonna listen to your valves.
Okay.
I'm gonna stay here and I'm gonna take your apical pulse.
Okay.
It's gonna be a whole minute. So
All right.
Alright. Just a minute. I'm gonna go back to the bell. I'm gonna listen to your carotids.
Okay.
Alright. Good. And then while you're laying, since you're at about a 45 right now, you just relax your head
Mhm.
and then turn your head that way. Okay. And then turn the other way. Alright, good. So now I'm just gonna be feeling all of your pulses, okay? Alright. Go back to apical again and compare it to the radial.
Okay.
Feel your arms out like this for me. Alright. You put your hands up.
Okay.
Right, I'm gonna pinch your finger. I'm just checking your capillary refill time. Make sure that you have good blood flow in your fingers, basically.
Okay.
And while I'm doing this, I am looking at your skin. I'm making sure it's the right color, temperature, texture, everything
Right.
like that. I'm gonna pinch you just a little bit. Check your skin turgor. That.
Okay.
You have any numbness or tingling in your fingers or anything like that?
No.
Okay. Alright, I move down here to your feet. Okay, same thing, any numbness, tingling?
No. No.
Alright. Touch your toes. I'm feeling for any swelling and edema, and you don't have any,
Okay.
so that's good. And then I'm gonna come back up to your abdomen.
Okay.
Okay. And then, sorry, your hair is still.
Yeah, it's fine.
So I'm looking. Talk louder.
Mhm. Okay.
Right now I'm just looking at your abdomen. I'm checking to see if everything's symmetrical, if there's any masses, anything like that that I can see. I'm looking at your skin. I'm looking to make sure everything looks normal. Okay.
Okay.
Have you had any changes in your bowel habits recently?
No.
No? Okay. When was your last bowel movement?
This morning.
This morning? Okay. Is that a regular pattern for you?
Yeah. Once a day.
Alright. Nice. Any changes in urination? Any pain? Any burning? Any changes in the color? Anything like that? Have you had any nausea, vomiting?
No.
Any changes in appetite, diarrhea, anything like that?
Nope.
Okay. What is your diet typically?
Limited carbs and sugar. A lot of protein, but overall everything in moderation.
Okay.
So.
Sounds good.
Good.
Have you had any reproductive problems? Any vaginal discharge? Anything like that?
No.
No? Okay. Sounds good. I'm gonna go ahead and take a listen to your stomach, alright?
Okay.
Listen.
Okay.
I'm gonna switch sides and listen to your vascular sounds. That sounds good. And again, this would all be done under the clothes, including all of the respiratory and listening to the heart, all of that. But for the sake of privacy, we're having everything covered.
Okay.
So we're just pretending. Okay, so I'm gonna feel your stomach. I'm gonna kind of press around a little bit.
Good.
So just let me know if anything hurts, if anything is tender. Any of that painful?
Mm-mm. Nope.
Okay, so we're gonna go one more time. And it's gonna be a little bit harder. So again, just let me know if anything hurts.
No. All good.
Alright. My hand under you. Now I want you to just take a deep breath and then relax and exhale.
Okay.
Okay? Alright. Sounds good. Let's have that a little bit.
Okay.
We're just trying to find a movement. Right?
Okay.
pattern. Doesn't feel distended or anything.
Mhm.
So I'm gonna have you sit up for me. Okay. And if you'll face this way so that your back is to the camera, just so everybody can see. Right, does that hurt? Also doesn't hurt?
And then I want to inspect at your ears. You don't have any lessons. I'm looking at you. You have any cerumen? Okay, you don't have any. I am looking at your ears. Okay, they're clear and you don't have any discharge. Okay, I want to look in the patency of your ears. Okay, I want to press here. Can you breathe? Can you breathe? Okay. So both of your ears breathe well, okay? You are perfect. You are good. Okay. So I want to percuss for the facial sinus of for discomfort, okay? I want to press here and I want to press here. You don't feel any discomfort? No? Okay. And then I want to inspect your mouth, okay? I want to look in if for your throat, for your tongue, for your teeth, for your gums, any I'm looking if there is no any redness, any cavity, any halitosis. No, it's good. Your mouth looks healthy, okay? And then I wanna inspect his neck, his thorax, and your lungs, okay? So can you move your shoulders? Okay. Can you move your hands above your head? Okay. Can you bring them back? Okay. Can you move your neck? Okay. And I notice the deep of your breathing. Okay. And now, can you sit down, please? Okay. I wanna osculate your chest. Okay. I wanna looking at your songs or your lungs. Okay. I wanna osculate in front and the back. Okay. So left upper, left lower, right middle, and right lower. Right upper, left upper, left lower, right middle, and right lower. Okay, I am looking if you don't have any breathing issues, any cough production. No? No. You don't have any cough production? No? So the sounds of your lungs sounds healthy, okay? It's normal. I want to write this down, okay? Okay. And then I want to do your heart. I want to assess for your heart and your vessels, okay? I want to osculate the pericardium, okay? And I want to where is the apical pulse located, okay? And I want to do for a whole minute and hear the presence of the S1 and S2 sounds, okay? So I want to listen at your pericardium. I want to looking for your apical pulse, okay? And where is the apical pulse located? Okay, so is it the middle clavicular line and the fifth intercostal space? 1, 2, 3, 4, 5. There you go. It's here. And I listen for a whole minute, okay? Okay, for the whole minute. Okay, so your apical pulse is 80.
which is normally, okay? It's normal. I want to write this down, okay? Okay, and then I want to palpate and auscultate your carotid artery, okay? So first, I want to palpate, okay? I want looking for any distension, okay? Okay, okay? And I want to auscultate each of the time, okay? Okay, it's normal. Okay, it's normal. Okay, and then I wanna assess, I wanna inspect for your jugular veins for any distension. Okay, I wanna look. Okay, okay, there is normal. Okay, and and then I want to know if you don't have any chest abnormality. Okay, no, everything looks normal. Okay, and I wanna write this down, and then I wanna palpate your radial pulse in the both hands. Okay, okay. First and one, and then the two. Okay, I wanna make sure they are bilaterally equal. Okay, and they are strong and firm. Okay, and they are equal. And now I want to make sure you don't have any edema in your arms and your hands. You don't have any swelling, no any redness. Okay, everything is good. And then I want to ask for your grasp. Okay, for your stress. Can you grasp my hands? Okay, perfect. Okay, you are strong. Your hands are responds well. Okay. Okay. So and then I want to ask for your abdomen. Okay, abdomen. So the first thing I need to inspect your abdomen. I need to see your contour of your abdomen, the symmetry. If you don't have any previous surgical incisions or any piercings, and everything looks normal. And then I wanna osculate your abdomen for bowel sounds. Okay. So can you relax? Okay, thank you. Okay. Okay, I am looking for a bowel sounds, okay, which is normal, okay, okay, and then I wanna percuse your abdomen, okay, and look in the present the tympani, okay, so you can hear it's like a hollow sound, so it contains air, which means that it is tympani here, okay, we can hear tympani here. Okay, it's like a hollow sound. Okay, but everything is normal. Okay, and the next step is I want to slightly palpate your abdomen. Okay, you don't have any. You have appetite? No. You don't have any abdominal pain? No. Any difficult swallow? No. Any nausea? No. You any vomiting? No. No. Any constipation? Any diarrhea? No. Any nothing? Raspy? Nothing? No. Okay, perfect. So I want to write this down. You don't have nothing, okay? So I want to ask you if you when is the last time you urinate? This morning. Okay. What color was? Yellow. Okay. Is milk like an hours? Yeah. Okay. And what about your last bowel movement? This morning. This morning. Okay. What color was? Regular? Okay. It is normal like always smells? Yeah. Okay, perfect. Okay. And then I wanna access for your musculoskeletal system, okay? I wanna looking at your knee. I wanna looking for any redness. You don't have any edema, any swelling. Okay, you don't have any edema, any redness in this knee, okay? And I wanna take your knees. You don't feel pain at bending? No. You don't feel pain at bending? No. Okay. And then I wanna assess for a stretch. So I wanna. Can you push this way? This way. Okay. And can you push this way? Okay. Perfect. Yeah. And then I wanna touch the bottom of your feet and the back of your feet and looking if you don't have any edema, any redness, any redness here and your back and your bottom of your feet, okay? They look normal, perfect, okay? And the last step, I want to palpate both of your pedal pulse, okay? I want to look for your pedal pulse in the both feet, okay? First this and this, okay. Okay, I want to make sure both are bilateral equally, so, and there is, yeah, both are equally in pulse. And the next step I need to remove my gloves. Every time I touch someone else's feet, I need to remove my gloves and do a hand sanitize, a hand hygiene, okay?